Hello, I'm Ileana Pina from Wayne State University in Detroit, and this is my blog. I am happy to say that I am here at the European Society of Cardiology HFA meeting, which is the Heart Failure Association. We are in Athens, and it is really a very exciting time for the HFA. The meeting is packed, there's tremendous amounts of energy, and it's really nice to see worldwide heart failure interest. I wanted to chat with you a little bit today about acute heart failure. There was an excellent session this morning where the whole topic was, what are we doing with acute heart failure? I don't have to tell this audience how many trials we have done that are either negative or neutral, including the very latest RELAX-2 trial with a lot of promise for this drug, relaxin, which didn't bear true when the randomized trial was done. But are we interpreting acute heart failure appropriately? And we don't have great guidelines on this, so everybody kind of does what they think they should do. But this session this morning had some very interesting points, and that has to do with high sensitivity troponins. Most of our labs in the United States are now adopting the high sensitivity troponin. And we're starting to find out that some of these patients, when they come in, it's not the troponin that goes up a little bit and then comes back down. We've been seeing that for years, but that some of them actually have true myocardial damage. And maybe those patients are a bit different than the rest of the patients. And maybe those patients should be identified just like we do our ACS patients. As patients get older, they don't get chest pain. They tend to get shortness of breath, even when they're ischemic. So it pays to take a look at the high troponin of the high sensitivity variety, and if it's going up and staying up before coming down, you may want to consider taking that patient to the cath lab. And if there is an artery that needs to be opened, do so, because reperfusion will actually be better for that patient. But we've never done a randomized controlled trial, and now we have devices that we want to put into these patients. The American Heart Association is starting a new clinical statement on shock. And we will be reviewing all the data on shock and hopefully having some pathways to clarity, because maybe acute heart failure isn't one group. We've been talking about HFpEF. HFpEF isn't one group. Maybe the acute heart failure isn't either. Take a look at your own patients in your own hospital and see if you can detect some of those differences. I'll be back with more of this. Thank you. This is Ileana Pina signing off.